to say your life gon' be lit. And you are now rocking with Celeste, the therapist. Let's go.
Hi. Hi, beautiful people. Let me just make sure my mic's on. Okay, my mic's on. So my name is Celeste. I'm a therapist from Boston. And let me just change this because we're talking about seasonal depression today. Understanding seasonal depression. I'm just changing the bottom. Okay, that was last week's subject. So last week we actually talked about on Instagram. So I'm streaming on Instagram, Facebook, YouTube, and LinkedIn. And last week we talked about substance abuse. And we talked about ways to understand it because I do recognize that it starts in subtle ways that we don't recognize. So definitely a really great episode to check out. You can find it streaming on all podcasting platforms or video, but definitely like a subject, substance abuse during the winter and fall seasons tend to take an uptick. And the way people end up becoming addicted to substances, it doesn't start as an addiction. And I think there's this misconception. So I hopefully helped people really understand that. Today, we're talking about seasonal depression. Every year around this time, I talk about seasonal affective disorder because, again, something that people don't understand. They just know. I think sometimes people are like, oh, this is how I am in the winter. This is just the way it is. And I feel like the more you understand yourself, the more you understand these things that may come up, it won't take over your life. And it's so easy for with the seasons changing, the lack of sun, and not recognizing the link between the sun and the seasons and how it affects you. If you don't know it, you just are affected by it and you make adjustments and just deal with it for the next few months. And I just want to help people kind of see their power in their situation. So one of the things I do if you're new to watching me is I create visuals with the topic just for some people that might be more visually inclined like me, where it helps and it's digestible. So if you are listening to me on the audio podcast, you can definitely go on YouTube and find these episodes. So let's just kind of start with like what is seasonal depression, or also known as seasonal affective disorder. So it's a type of depression that's triggered by the change of seasons. It most often happens in the fall or winter. So it definitely happens in the spring and summer, but it's not as talked about. But right now we're talking about what's happening now with the seasons changing. It's not something that's in the DSM. So the DSM is a book that people like me, well, I don't use it. I don't like that book, but where we diagnose people, and it's not something where it's a diagnostic diagnoses, but it is something that occurs. And so basically, as you can see, it's triggered by seasons, most often in the fall and winter, and it's depression. So let's talk about the symptoms that take place. So these are a lot of the symptoms that take place. So feeling listless, basically like no motivation, sad, down most of the day, nearly every day, losing interest in activities you once enjoyed, having low energy and feeling sluggish, having problems with sleeping. A lot of people tend to sleep a lot more, like hibernating, experiencing carbohydrate cravings, overeating, and weight gain. A lot of times people tend to gain more weight during the winter times, and you're not realizing that you're having these cravings and you're eating and you're stuffing your emotions away. Having difficulty concentrating, feeling worthless, hopeless, or guilty, and also having thoughts of not wanting to be here. These are signs, and if you know the signs of depression, these are literally similar, same symptoms of depression, right? So people that already struggle with depression, especially if you're in a cold weather state, the seasonal depression, unfortunately, you're more apt to be affected by it than others, right? So, what are the causes of seasonal depression? There are no real identifiable things we can say like, oh, okay, this is going to happen because of X, Y, and Z. But these are some factors that are included. So your biological clock, the circadian rhythm, the reduced level of sunlight in the fall and winter may cause winter onset SAD, which is seasonal affective disorder. This decrease in sunlight may disrupt your body's internal clock and lead to feelings of depression. The light affects us a lot, and a lot of times we don't know. During the pandemic, because a lot of people were staying in, not moving their bodies, not getting sun, a lot of people were experiencing a lot of these symptoms, right? And that's why, like at nighttime, when I'm talking about sleep and your sleep hygiene, paying attention to your screen time, the lights, all of those stuff matters. It's confusing the brain. And that's why, like, if you're somebody that struggles with sleep, start to develop a sleep routine, because basically you're telling your brain like, okay, I'm starting to wind down. It's time to go to bed, right? When you wake up in the morning, you know, when the clock goes back and you wake up in the morning and it's dark, your system is confused. In the next couple of slides, I'm gonna talk about light therapy, which is one of the things that people use to help treat this. So serotonin levels. So there is a drop in serotonin brain chemical levels that affect your mood and might play a role in SAD. So reduced sunlight can drop in serotonin that may trigger depression. And then melatonin levels. The change in season can disrupt the balance of the body's level of melatonin, which plays a role in sleep patterns and moods. So these are all, these are all things, right? Regardless of what you got going on, how much money you have, it's important to understand some of the ways that life affects us, the sun affects us, right? Like thinking about what we can do to be proactive. Because every year, fall and winter comes. Anybody who works with me, they already know, like around this time, we're talking about, all right, you know, fall, winter's coming. Like, what's the plan? What are we doing? I know you've been like walking outside, but it's about to be cold. So we got to figure out another plan. I'm a very, very proactive provider in the sense of not just talking about like the stressors in the moment, but just thinking about the other things that are coming up that you should think about. So I do want people to start thinking about this, because not having, when it starts to get cold, we don't feel like moving your body as much, like you're highly affected by it. So let's talk about some treatment, right? So treatment for a seasonal affective disorder. So light therapy, having therapy and medication. Now with light therapy, I want to point out, definitely like talk to your doctor about it, especially if you struggle, if you have bipolar, because it can potentially trigger manic episodes. So there are things like vitamin D that's important for us to have, where I'm like, check and find out what your levels are, because too much vitamin D is not good for you, right? Because people be like, oh, take this vitamin D pill, take this light therapy. And it's important to know that sometimes, depending on the way your system is operating, especially if you have bipolar, the light therapy may not be the best option for you. So be mindful of that. But I'm going to talk about strategies to prevent and manage it. Before I do that, I just want to play this quick video where it talks about how to avoid seasonal depression. And it's interesting because anytime I bring this up with people, a lot of times it's the first time they're hearing it. People do call it like the winter blues, but I do think people feel like they're at the mercy of fall and winter. I can't wait for spring. Like the fact that November, December comes and we're like, we can't wait for spring. So does that mean that I suffer for the next 3 months? Like, I'm the type of person, I refuse to suffer. And I'm like, there has to be a better way. That's how I've been my entire life. And so I do want you to know there is another way to think about doing this, so that you don't feel like you're at the mercy of the seasons and being okay. So let's go ahead and watch this 3-minute video together. Turn it up.
The end of daylight saving time, seasonal depression. Nearly all of us wound our clocks back yesterday. When we fall back, the sun rises and sets an hour earlier. That can disrupt our natural rhythm and cause the winter blues, or the more severe seasonal affective disorder. Psychiatrist Dr. Sue Varma is here with how to avoid the possible impact. Good morning, Sue.
Good morning.
How does a 1 hour swing, just a 1 hour swing, have such a significant effect on our moods?
So our body clock, our circadian rhythm, relies upon two important things: routine and light. And even a 15-minute change in our bedtime or wake time causes a major disruption. And what we're finding is it's not just this one day, right? We think that magically we wake up and we have an extra hour, but the shorter daylight hours leading up to it is particularly difficult for people who are prone to seasonal blues or affective disorder.
And this is something that affects women more than men, potentially seasonal affective disorder?
Yes. And if you can believe it, 4 times as many women are affected than men.
Wow.
And it's not entirely clear, but we think that women are more sensitive because of hormonal fluctuations to depression in general, but particularly to the lower daylight hour. What we're finding is serotonin is lower. Serotonin is really important to maintain our mood, to decrease our irritability. Serotonin is noted with carbohydrate changes. People get more carb craving. They want to sleep more. They want to eat more. And the opposite is happening in the springtime.
How do you know that it might not be depression and just plain old wintertime blues? What's the difference between the two?
Yeah. So 5% of the population, depending on what part of the country or what part of the world you live in, will be affected by seasonal affective disorder. And this causes impairment in our functioning. So the person is actually missing appointments. They're not able to get to things. They are avoiding people. They're procrastinating. And this has an impact on their job and their relationships. They're drinking more. They're fighting more with their family members. But the blues, which 15 to 20% of people might have, and it often flies under the radar, unfortunately, is more of the hibernation, where you're like, I don't feel like it, but you're able to get the stuff done.
What do you do to keep the blues or even depression at bay?
Yes. So the first thing is start early. I say people often who have seasonal blues get it year after year, starting in fall. So light boxes are a very common thing, but do that under the care of a professional. Exposure to daylight in the early morning hours between 7 and 10 a.m. If you can get 20 minutes outside, that's really important, because what it does is it shuts the melatonin off. We think of sleep and sleep hygiene as something you only do at bedtime. No, you have to start in the morning. Physical activity is really important. Social support, limiting caffeine after 4 p.m. and exercising every day is really important.
All right, so settle a debate online from a medical perspective.
Yes.
Daylight saving.
All right. So as we can see, she kind of gave some reasons why this happens, right? And then thinking about ways that you can avoid it. So lessening your alcohol consumption, paying attention to what you're eating, because the cravings are going to come, especially in the morning. If you can get some sun in the morning, opening that curtain, standing outside, letting it hit your system. These are things that we're not taught. Most times, if we go to the doctor with these symptoms, they're going to prescribe us some medication. They're not going to ask us what our diet and exercise routine is like. They're not going to ask us if we're getting any sun. They're not going to ask us about our sleeping routine, right? Some do, right? There are some doctors that are more holistic driven and asking those questions. But it's important for you, even if your doctor is not asking those questions, it's important for you to check in with yourself and be real with yourself and ask yourself, actually, what are you doing to help mitigate some of the symptoms that you're experiencing, especially if they're outside of circumstantial things that are happening. So strategies to prevent and manage it. So sunlight, exercise, diet, sleep, socializing, stress management, paying attention to your stress, and what are you doing to manage it? Planning activities, staying hydrated, and avoiding electronics before bedtime is important. So that, in a nutshell, is what seasonal affective disorder is. If you have any questions, feel free to ask. That's what seasonal affective disorder is. A lot of people are experiencing it around this time. It's about to start, right? The clocks go back in November, but as you can see in the video, this starts even before the clocks go back, because we start to notice a change in the way that we're seeing the sun. We're not going to see it as much first thing in the morning. And then, especially if you work late hours, you may go into work and come out and it's dark still, right? Recognizing how those things can affect you and being proactive about making sure you're doing something to change the situation, whether it's like, I'm going to make sure I move my body. I'm going to make sure with my stress level, right? Because stress affects in the summertime. Think about it. In the summer, springtime, certain things happen. It's easier for you to kind of roll with it or deal with it than it is for the winter. Something that happened in the winter, if it happened in the spring or summer, it may look different with your response. And so I need you to think of managing your life and dealing with your stressors as what is my everyday routine to living life. So for instance, like when you're surviving life, you're making sure that you're eating, you're drinking water, that you are, brushing your teeth. There are certain things that it's like automatic that you do to survive, right? Now, when it comes to living, I want you to think about what is my routine for living. And a lot of times we don't think about it that deeply. We don't think about what are our routines and the things that we're doing, because the job is stressful. So what am I doing when I leave work? Am I grabbing a bottle of wine, or am I taking some time to like stretch? And am I taking some time to journal? Am I taking some time to reflect on how I'm feeling? Um, how can I help somebody that is struggling with seasonal affective disorder? Great question. So, when it comes to, like, let's say you're not the person and you notice, like, you know what, I think my partner is struggling, or my kid, or whatever. Awareness, right? So it can literally be starting with talking about, hey, like I seen this thing about seasonal affective disorder and it affects people around this time. The more people are aware of what's going on, the more they can actually manage it. And believe it or not, people will feel, a lot of times people feel broken. They feel like they're damaged when it comes to how they are, and not even recognizing like there are things that are happening or that has happened that has created where they are, but it doesn't mean you always have to be that way, right? And so if you are listening to this and you're like, oh my gosh, like this happens to me all the time, or someone else, like spread the word and let people know, because people don't know. You only know what you know, right? So I hope this was helpful. I hope this makes sense. If anything I ever say resonates for you, I always tell people, like, understand, like, you have power to create change. But it starts with the little things. I said on my social media the other day, I was saying, like, sometimes when problems feel so heavy, and I'm talking about things like, oh, going for a walk or looking at your diet, it's kind of like, well, how's my diet going to pay my bills, or how's my diet going to stop my partner from treating me like that? Or a lot of times I think, instead of us doing the little things, because we can't see beyond like where we are, try not to think about it like that. Try to think of it as like, let's say I need to get to Z and I'm at A. Like, it's going to take time for me to get there, right? As I go through the alphabets, A, B, C, D. But look at it as if, like, you know what, let me just take this first step to get to B, because that pushes me further along. And so sometimes the little things don't feel like they make sense, or it doesn't feel like it's going to make a dent, but I promise you it will. Literally, like, if you're somebody that struggles with routine and consistency, just start setting yourself a time to wake up and making up your bed in the morning. Start with that. Make up your bed for like a couple of weeks and watch and start that routine start to come in heavy, right? I literally wanted to get back into reading more, but I kept saying like, oh, I don't have time. I would listen to audibles, but I really enjoy like reading an actual book. And a few months ago, I became intentional and I set my alarm for 9:30 every day. And I set my timer for 25 minutes. So that means like I made it a point to read until my timer went off at 25 minutes. At the beginning, I'm like, okay, cool, I did my 25 minutes. But then because I was doing it so often, my system started to crave the book. It was like, when do we read? So now literally I wake up in the morning and I grab the book to read the book. I'm going through books so quickly because I made it intentional. Like, it was important to me and I decided to do it. And so think about like what's important to you and what do you need to put in place? What systems do you need to put in place to make it happen? And I don't think we think about things that deeply. We don't think about like, well, what can I do to make a change? If things aren't going the way that you would want it to go, or if you're not going in a direction of your goals, check in with yourself and be like, what am I doing actually to make it happen? Right? Look at your screen time, see how much time you're spending on social media. And then if part of what your excuse is time, check in with yourself and be like, I say I don't have time, but when I check my average screen time for social media, it's looking like 5 and 6 hours. Is that true? Do I really not have time? Like, sometimes we have to take accountability and really make radical changes in our lives And it doesn't mean we have to change everything overnight at one time, but it do means like just taking that one step. And before you know it, you're at B, then you're at G, then you're at R. Like you're really starting to be like, oh my gosh, I'm like so close to my goal. But it takes you taking that one step that may seem insignificant, but very important. So if you want to learn more about me, you can go to celestetherapist.com. You can find me on all social media platforms. You can also check out my my wellness center. It's called Shifting the Way You Think. I'm having an open house. So if you are in the Stoughton area, November 2nd, I'm having an open house. So if you're a provider or if you're somebody that wants to learn more about the services and the things that we're going to have at the center, the goal is to create content and workshops around these areas right here: financial, wellness, intellectual, occupational, physical, social, spiritual, and emotional wellness. So that's my goal. I've always said that therapy and psychiatry are not the only modalities of healing. And also, sometimes for people, therapy doesn't work. And I think sometimes people feel like they're failing because they can't find a therapist, or they've tried therapy and it doesn't work. Depending on the person's approach, it may not be the best option for you. It may not be an option that's working. And so my goal is to introduce to the community like all these other options, all these other practitioners and wellness providers that are doing the work that may not be as conventional as the American system. So that's something that's so important to me. Hey, Kush. So thank you all so much for rocking with me. We'll be back same time Wednesday to talk about something different. If there's ever a topic you want to discuss, make sure you hit me up. All right, guys, I'll talk to you later.
Focus and your life gon' be lit. And you are now rocking with Celeste the Therapist.